This sound produced while breathing is called as inspiratory stridor. This is produced due to presence of abnormal loose tissue around the voice box, a condition called as laryngomalacia. A normal voice box looks V-shaped, but here it looks floppy and omega-shaped, thus causing breathing difficulties. In severe cases, surgery to trim the excess tissue may be needed to restore anatomy. Let's see how the surgery is done. Here, using very fine scissors, the surgeon accesses the area with the floppy tissue and trims off the aryepiglottic folds in an anesthetized patient. The surgery would need precision and good control, as the area is highly sensitive and extremely small. The same procedure is repeated on the other side. The third step now would be to cauterize the base of the epiglottis to make it taut and reduce it from collapsing during breathing. Post-surgery, near normal anatomy is ensured. This is video of the same child 24 hours post-operation and with no stridor.